that is obviously one of the big concerns, is that somebody will take this issue and apply it across the board to make assumptions that the vaccines are not safe. And that's just not true. The lesson I would recommend that people really take out of this is how sensitive our monitoring system is, that we were able to pick this up and really see the linkages and the ties between these particular cases to identify that there might be a potential problem, and therefore take action quickly to ensure that we have safety moving forward. So I think there's something to be said for the transparency of the program, the fact that there's a very rapid response to this as soon as they realized that there was a possible linkage here, and then further investigations to really peel back the layers and see what is the causal factors, what is really happening here. Is this related to the vaccine? And if so, then let's make sure that we are properly informing the public moving forward. So for those that want to point to this and kind of do the, I told you so on vaccines and stuff, I would argue that, we're demonstrating how transparent this program is, that we have a very good reporting system, and that we closely monitor the safety of our vaccines, and we take the safety of our vaccines very, very safely. Out of an excess of 2 million doses is about 125,000 doses of Johnson & Johnson. So we really had not ramped up to the point that we had become dependent on Johnson & Johnson vaccine coming into the state. Therefore, we have Moderna and Pfizer on hand and in stock that we can substitute in areas where clinics were using the Johnson & Johnson. So we have a very good viable option for those that were scheduled to get Johnson & Johnson. And we just need to adjust our plans somewhat to focus on Moderna and Pfizer until this is resolved. We will assume that Johnson & Johnson will probably come back online soon. But until then, again, we have very good options out there. So we expect really minimal impact overall on vaccine efforts. You're right, Johnson & Johnson, because it's a single dose vaccine, offered us a logistical edge in working with some populations. A lot of that work has already taken place. A lot of those populations we have reached out to and worked with to get them vaccinated. So I don't know that that's really going to derail us too much on that. And I anticipate, again, that this will be a temporary setback, but we will find out. We will monitor it very closely. In the meantime, yes, we're kind of back to our previous challenges of figuring what we can do with 2-dose regimens out there, and we'll just continue to adapt. This entire response is about adapting to the logistical challenges, and here's another one that has come up. So yes, there is the impact on our ability to use a single-dose vaccine in some ideal circumstances. With that temporarily off the table, we will just adjust, and we'll have to go with Moderna and Pfizer where available. And hopefully we encourage those individuals to continue the efforts to get vaccinated. And in many cases, it may mean that we need to add in some extra logistical work to get them those second doses. We woke up to it like you did. This was a very rapidly developing situation that came about this morning, and we were not aware in advance that this was coming or pending. We have no awareness whatsoever. Any of these cases are linked to Oklahoma or tied to Oklahoma, so we had certainly no firsthand knowledge that there was any concerns. So yes, we are reacting rapidly to this, as we have throughout this pandemic, and especially as vaccine rollout. New information comes on board, and we want to respond as quickly as we can to it to make sure that we make good decisions moving forward. We need to be transparent. We need to put safety first. And really what they're doing is they've identified that there is a possible issue, very low incidence. You're talking about less than 1 in a million here. But if there's a possible link, it's important that we identify what that link is and make sure that we inform providers about this.
For more information, you can visit tulsaworld.com.